Hello.
Hello, morning, ladies. Today we have got Dr. Emma Kirk, osteomyologist and
Morning.
presenter. Good morning, Emma. And we have the lovely Vikki Padgett, head of voluntary services at the Mid Yorkshire hospitals.
Hello.
Hello. So, there's a lot going on in volunteering in the community and also in the hospitals. I do voluntary work at St James's and I'm heavily involved with different projects at Pinderfields. But what I'd love to know, Vikki, how have things changed for you since COVID-19 with the volunteer programmes?
Yeah. Changed hugely. Prior to COVID-19, shall we say, we had over 600 active volunteers. Anybody who's visited the Mid Yorkshire hospitals, which is Pinderfields, Pontefract, or Dewsbury, will probably have seen our volunteers wearing the yellow uniforms to meet and
Yeah,
greet you. We have had active cafes at Pinderfields and at Dewsbury, and we have hundreds, especially younger people, but ward befrienders, active people on wards helping patients and staff supporting, and lots of roles. We have about 50 different roles, to be fair, some of them individual roles, maybe with a motor neurone disease clinic, just one volunteer in there playing a really important part. Since this has all happened to us as a community, many of our volunteers, or the large part of our volunteer base, have stood down, and we've actually had to ask our volunteers to stand down. Many of them wanted to continue, but because of the government guidance with the underlying health conditions, with the over 70s, if you live with people that have that long-term conditions are at risk, etc., that's meant that we have been left with around 20 volunteers out of the over 600 that were able, fit and able, or willing, because obviously there are some people, and this is understandable, who do not wish to come to the hospital and volunteer at these times, with the risk that potentially, because you're more active in your community, could take home. So we've reviewed our roles, and the main role that we have is our guiding role at each of the three hospitals. And that's largely to make sure that we can support people who want to bring things to the hospital for patients, support staff, but also act as gatekeepers. Are people correctly at the hospital? So that's been a vital role in the hospital. Plus, supporting our employee benefits team with the distribution of so many gifts, donations that have been made by communities, individuals, businesses, charities. You've probably seen them, you've seen them on the news, you'll have seen them on your Facebook live streams. There's been so many gifts of items that have been really appreciated by staff, bottles of water,
mm-hmm.
drinks, snacks, all sorts of things that have been donated that make a difference when our staff are busy, long days, tiring days, and then can't get to the shops at the same time as everybody else can. Or if they do, they don't want to after they've worked a long
Yeah.
shift and then got to queue for an hour. So yeah,
Vikki,
it's been a real change in the hospital for volunteering.
would you say that there's too much being taken to the hospital? Because I'm aware it must be such a hard job to manage the food, the drink, the items that help with protective clothing like the mask extenders.
Yeah.
I know a lot of my ladies from the Mid Yorkshire Breast Cancer Support Group at Pinderfields have really welcomed being able to step up and sew or crochet scrubs,
Hmm.
wash bags, extenders. But we don't want to actually waste time making them if you're at the limit. And
Yeah.
we have liaised with Joanne, who's been amazing, to say,
Hmm.
hold off on these products now, they're okay. And we've diverted those attentions to Jimmy's.
Yeah.
So this evening, I've got one of the senior nurses collecting, I think it's 150 wash bags and
Yeah.
25 extenders and headgear. But we don't want to overload you if
Yeah.
you have sufficient items.
Yeah. With regard to the food drink items, I can't really comment as to where we're up to with capacity with that, as it's a different team. So we do have a team that in the hospital, if they contact voluntary people, contact us, voluntary services, we put them in touch with our employee benefits team who are managing that really well. And they're based up at the Abacus nursery. So nothing comes direct to the hospital. They're based at the other building. That's to reduce footfall to the hospital and to manage it. And it's a storage base. And then they corporately, centrally distribute out not only to the hospital sites, but to all our community bases, not forgetting our district nurses and the community hubs. With
Yeah.
regard to the made items, we have been blown away by the generosity of communities. It's been small businesses, medium businesses, schools, colleges, previously set up sewing groups, individuals, and then also people have come together as a group to sew. So we know that there's the Wakefield WI group.
Yeah.
There's one that's been purposely set up called Your Sewing Machine Needs You, and that's in the Sandal area of Wakefield. There's ones in Walton that have just popped up. I've got ones. I live over Home Firth. I've got Home Valley Stitches here of 60 people come together just to sew.
It's
This
quite
has been
funny
a
actually.
one.
From mine and Emma's background of being cancer patients, um, a lot of the support groups would have like a knit and natter session,
Yeah,
and we're now calling it stitch and bitch.
yeah. I think we need that release sometimes, don't we?
Yeah.
But going back to
So
your question about where are we with numbers, as I say, over 1,000 pairs of scrubs have been made for the trust. And I want to reassure people they become our property. So, like many organisations, we use a regional organisation that launder, and normally we have stock that's rotated. Now, our stock now, everything that's made, the scrubs, come into the hospital and they're stamped with Mid Yorkshire Hospital name on. So they become our property. So some of this has been funded through fabric that we've purchased as a trust, but largely it's through donations. So we want to reassure people they're not going to get lost into a big system. They will stay for Mid Yorkshire. What you've made will stay for us. They'll be laundered and returned. We've got over 700 uniform, the wash bags that you alluded to, 600 ear savers, 400 of those connection hearts that are so vital to keep people in contact with their loved ones, maybe as they pass away. So
Vicky, tell me,
I was just going to say, we are actually at our limit now. We don't need any more, and it's really useful to be able to get that message across. So thank you for the opportunity to say that. We're so
No, that
thankful,
it
but we
is
don't
really
need any
positive as
more.
well.
Scrubs we
I think
do.
that's scrubs. Okay.
We do
Okay.
still need scrubs.
Right. I was going to say it's really positive to hear this, because most of the things we've been hearing in the media is about a lack of and
Yeah,
a lack of equipment. And to hear you say you have reached your limit on certain items, I mean, that's
yeah.
just such a phenomenally positive message for everybody in our area who's been, sewing. I mean, I haven't been sewing, because if I sewed something, believe me, it would be useless. I'm not renowned for my skills
yeah,
and expertise in the sewing department, or
We've all
knitting
got
for that
different
matter.
skills, though.
But like, for everybody who has been chipping in and
Yes,
dedicating their time or donating fabric, or even just cutting fabric up for someone else to
exactly.
sew, and then picking up and delivering, I just think it's
Driving, walking. Yeah,
yeah, it's such a magnificent thing to be able to say here. And certainly I think yesterday people were a little bit disappointed by the
yeah.
the announcement. So this is a lovely thing to be able to say to people, and your
It is.
efforts have definitely been worthwhile.
Definitely. And as an organisation, I'll be working with our communications team in a way to get that message out. And
Mhm.
one of the things that I'm going to be working on with comms is just trying to get the tech side. As I alluded to with you, Emma, before, that's not my area of expertise. I can sew, but not tech. Is I'd love a headshot, like a passport size photo of anybody who's been involved, because I've got something up on my wall here which was around the centenary of the vote for women. And in my local area, there's lots of people, including me, took a passport size photo, and then it was put into a poster. And I've asked our comms if we can do something like that. Anybody who's been involved in any way in this massive support to we're talking about Mid Yorkshire. We know it's happening broader than that, but for Mid Yorkshire, to send a photo. So we're going to get in touch with people and tell you how we can do that, how anybody who's been involved in making. But we want, with people's permission, to drop your tiny photo, and they may be into a thank you, the word thank you. They're used on our site, our website, used in social media, in publications, some way. It's a very small way, but it's just to acknowledge the hundreds of people that have been involved in this. It's so heartwarming.
I can help you with that, Vikki. We have
Oh,
a closed Facebook group for the
yeah,
MY support group, and we
yeah,
have 170 people online. So I can get headshots and email those across to you and put a message
fantastic.
out to the ladies that have supported the project.
Thank you.
And I'm not sure if you're also aware that there is another scheme where people can make 6 or 4.5 inch quilt squares with their
Yeah,
names on. And that's going to be promoted and sewn together at the Thackeray Medical
yeah.
Museum and
Museum.
also Pluntigate Centre in Horbury.
Hmm.
So again, that stitching is stitching up the community, isn't it?
Oh, it is. And it's such a lovely way of, I am a quilter, so I'm passionate about that. So I've been spreading the word, and I was going to be sending it out to all the makers as well to invite people. If you've never made a quilt, it's nothing to do with a quilt. It's a piece of fabric. And some of them, the designs on them are so lovely. It speaks about what is it meant to you. And some people are using them from the scrubs, cast-offs as such, the scraps. But what I think is we've been also thanked by people in the community for giving them a purpose. And this
Yeah.
is what I think me and my team, it's not really surprised us, but it's taken us by surprise. The sort of volume of the thanks that are coming to us to say thank you for giving us a purpose. Thank you for helping my well-being. Thank you for giving me an activity daily to do. So many people, as we know, are now either stepping down from work, or they were already not at work and therefore even more isolated because people can't visit, they can't go outside. My parents are shielding, my parents in Lauderdale are shielding, so they can't even go outside, they've got to stay in their house. So
To be
people are
fair,
thanking us
Vikki,
for giving
we've
them that opportunity.
yeah, we've got a lot of people shielding, like myself,
Hmm.
and often it's a case of we've got certain volunteers going around dropping material off, quarantining for 24 hours,
Yeah,
sharing patterns and skills, and there is a sense of purpose. But I think when you've had like a cancer journey, you've had so many hundreds of thousands of pounds spent on you,
hmm,
and you've attended so many appointments, it's so little to give back.
Mm.
mm,
Now, for myself, I'm seeing a lot of patients that are frightened to attend appointments or to contact the GP. How has the distancing worked in hospitals, to keep people safe, that's
yeah,
staff and volunteers? I'm
yeah,
trying to get a message across to patients that, you know what, it's very safe to go into a
yeah,
hospital if you need
yeah.
to be seen.
It is. I work in the hospital, in the main hospital, in an office. So I walk through the hospital, I go to the reception area, I go to departments. I'm not on the active, the red, the hot wards, whatever you want to call them. And we social distance. And, people are walking away from each other when you're passing each other. If you need to wait in a waiting area, staff support you to wait safely.
Mm-hmm.
Um, there's no shortage. I know there's been talk about in the past of shortage of alcohol gel. There isn't. So there's lots of alcohol gel around. You can keep your
Thought you
hands
were going to
clean.
say alcohol then, sorry.
Well, yes, that's part of the essential shop. But I really would like to encourage people to come forward. We see people waiting for maybe their bloods to be done, in phlebotomy, etc. And it's all done in a safe way. You may need to queue, you may need to wait for your appointment, as you do anyway, but it's with that social distancing in place. We've got people in the organisation that are specifically looking at how can we make sure our staff and patients stay well as services start to return to some sort of future, whether we want to call it normality, but future of bringing people back to the hospital, and they will be safe. So we know our numbers of people coming forward with concerns as to whether they may have something that could be cancer related or attending appointments has dropped off to a certain extent, and we want to encourage people to return and to come back.
So, Vikki, if people have to go to a set ward, like the breast
Mm-hmm.
clinic or the Macmillan Information Desk
Yeah.
on level D,
Mm-hmm.
are people using the stairs or avoiding the lifts?
It's a
Is
mixture.
there a
What we're
protocol?
trying to do is a lift, one person at a time. So when I'm carrying something heavy, because I try and do my bit and keep myself fitter and use the stairs, try to. But if I'm carrying something heavy, like a load of scrubs I'm bringing in, I'll go in the lift. And if you're in the lift, people don't come in. So it's one person at a time. There's a lot less people in hospital. So the lifts, many people will know them. So we've got 4 lifts on one side and 4 on the other, 3 on the other. But it's enough to keep people using the lift if they need to. You're not waiting a long time in that area. The others of us are using the stairs, one side up, one side down, and however you want to do it, looking away, etc. Some people are wearing masks because they're within an area, they're moving from one area to another, and that's what they need to do. But they dispose of them if they come out of an area where they need to use them, so they dispose of them. They're not bringing anything out. We don't use masks. We're in the hospital on a almost daily basis. We don't use masks. We just make sure social distancing and wash your hands or alcohol gel with your hands regularly.
So, Vikki, you share the office with the chaplaincy, is that correct?
That's right.
So, when they're doing rounds and visiting patients, do they have to wear protective gear?
Yes. So we've provided them with scrubs from people that have made scrubs. So they've all got their own sets of scrubs and the uniform bags, and it's a change for them to do
Mhm.
that so that they can take them home and wash them themselves and bring them round. But in addition to that, if they are in an area where it is advised that they wear the additional PPE, so it is very clear for our staff what areas those are, and there are different levels of PPE depending on what area you work in. So some of our chaplaincy team do go into ICU, and so they will have the whole range of PPE, the fullest kit that you can. They've been what's called fit tested.
Yeah.
So anybody who wears the masks and the equipment needs to be tested to make sure they're capable, but also it fits well. So they're all set up. So that's all our multi-faith. So including our Muslim colleagues, our Church of England, our Catholic, etc. They've all been trained so that all those people can go into those areas if needed.
So, obviously, there's different levels of illness and different levels of severity of COVID ward areas. In terms of the multi faith chapel area, is that being used at all in any way? Are there um, I don't know, a hospital radio that people can tap into if they need?
The chapel itself has been stood down, if you like. So it's been around that it needs to, because Friday prayers were put online in a different way, etc. Changes were made. It was, as far as I'm aware, I think that's still the case. Staff can visit, but it's not open to the public as such, etc. But that may have changed. So I'd need to see what the latest guidance is on that. Things are moving fairly
Yeah,
quickly.
it's going to change all the time, isn't
They
it?
do, they do. Our hospital radio aren't actually broadcasting. That's because they need to come into the hospital as
Mhm.
volunteers, and they fit largely into that over 70s or with underlying health conditions. So it was a decision made not actually to continue with that at this time. As and when we can safely bring that back, we will.
Okay.
We do have a
Um,
question actually, Vikki, that's just somebody's
Yeah,
asked. Do the staff have access to counselling support if they need it? I mean, because obviously they're going to be quite traumatised by what's happening as well, aren't they?
they are. Yes, the trust has set up something called My Wellbeing, Mid Yorkshire, My Wellbeing,
Mhm.
and we have what's called hubs. They're across the hospital in different areas where staff need them, and these are for the immediate breakout. Take 5,
Mhm.
mindfulness breathing, look at some positive messages, etc., for that time. And then there was also been established, including our psychology teams and our chaplaincy teams, and some people from within our cancer management area as well that you may be aware of, so that already have the counselling and the mindfulness skills. They have set up a central area. So at the moment, that is actually where the Macmillan Information Centre was, because that service has gone onto a phone basis and has been for a while. So it's on level D. So that's for our staff to access one-to-one support, counselling, etc. And this will evolve over time. There are plans, there are people from our learning organisational development team, our chaplaincy team, and then our psychology, the trust psychology, all together working, finding out what's best for our staff. So yes, they do have access to that.
Has there been much take up on it?
I don't know, to be honest. It's not an area that I have much knowledge about. I am sorry. I do know that last week I was at a workforce meeting and it was cited that people are starting to access it. Yes. In addition to that, we already have, as every single member of the trust has access to a counselling service by phone, and you just self-refer, you ring up and you can speak to a counselling service that will give you a certain number of appointments. That's via our Rocky Health, has been funded via them. So we obviously people may be using that, but then there's also the front end one that people can now use.
So Vikki, you've talked about the Macmillan Hub has moved from level D, and obviously people are not going to be walking into the hospital to visit for support. I've referred quite a lot of end-of-life patients there who might have a pet and need to rehome it. I've been able to leave a message and they've got back to me and we've helped those patients out. Obviously, I'm working by memory of the hub, and that has changed a lot. So are these support workers working from home by phone?
No, they're working in another area of the hospital called the NRU building. I don't know why it's called the NRU building, but it is. So they're working in the NRU building, and they're providing 7-day-a-week service. So by phone. So it was one thing that Kimberly Priestley, Information Centre Manager, was very keen that actually was spread. So I know Kim's been working the weekend shifts, and the other 2 members of staff have been working through the Monday to Friday with support from Kim as well.
Well, we're hoping to get Kimberly and Keely in a chat at some point later.
Yeah.
I think that kind of support for the community that people don't see working 7 days a week is quite amazing. What inspires me is how, I'm not getting back on the sewing theme, but everything seems to be working seamlessly. It's just great to see the great spirit of different areas of the hospital pulling together, because it must be the hardest time. What's the general temperature check of how the staff are feeling?
I suppose I'm quite distant from the ward staff, if you like, so I can talk for support, for staff, for community staff, for people that I'm in contact that are not what you'd call on the front line, either in the district nursing teams, community teams, or on the wards. There's been a certain energy that's come from this for us all. I take that in a positive way. It's not the environment we want to be in. It's not the situation we want to be in. But actually, we've been enabled, we've been empowered to take action, work differently. So sometimes make things happen quicker than maybe normally with the red tape that we all have to go through. There's been a consensus of opinion of we just need to get this done, and we need to get it done quickly. So the work around procurement that I've been working with the likes to the scrubbed, etc. Some of the teams set up, which has been amazing. People have been redeployed, so from some of the corporate nursing roles and the other services roles into a family liaison team. So these are members of staff who don't normally work on wards, who now are part of that, getting messages to patients. So we have a messages from home email address, telephone number that's been advertised. So that's another team now. Our PALS team are taking those and transcribing if it's rang in, taking the emails, passing it to a family liaison team who haven't been in this role before. They've all stepped into this role willingly, and are now taking these messages to patients on wards. Some of it can be, we've also got the iPads that are in use, like many other hospitals. So to keep that link so people can see people face to face, it isn't just the written word. So you can maybe see, people have sent in photos of birds, of dogs, of people's pets, things like that can be taken to patients because they can't currently have visitors.
So they're bringing the outside world indoors, so people feel connected yet again.
Yes. And I think that's where, yes, it's been challenging at times. How do we do this? How do we make it happen? But it's happened, and it's happened quickly, and it's happened for the benefit of the patients, but also for the benefits of staff who now feel they can give the patients what they need. They can give that contact, that holistic care.
So do you feel we've got a lot to learn about treatments and appointments going forward with the world of virtuality? I've just had a headache with new technology and thought, this really isn't me. I'm out of my comfort zone talking to myself on a screen and thinking, hell, but for the good of God and everyone else out there, if it makes a difference, you're going to do it.
Yeah.
Can you see appointments and conference calls continuing in this vein?
I think so, definitely. The NHS was already on track with some of that. Some of it's been around for years, your telemedicine, your telehealth, etc. And I think it's been stepped up, and some of the national infrastructure to help that happen, I'm aware, has been happening more quickly than was planned. We know that we're having those virtual clinics to a certain extent happening. I've done it with my GP, and it's not about oversharing here, but I do want to encourage people. I had some symptoms and I spoke to my GP, and I would live in the Home Firth area, so it was Huddersfield Hospital. But I had an urgent referral put through, and it was because there was a worry of ovarian cancer, and it was dealt with within a week. So I want to assure people you still can do that. You speak to your GP, it was on a telephone, and then a follow-up telephone, made a referral, and 2 days later I was at the hospital and safely having that scan. So I think these things will move, and everything, it is all okay. It's not that, it's there's something else going on. But I just want to assure people that it can work, and if we embrace it. I'm not used to what I'm doing right now with you, so I'm not looking at myself because I hate looking at myself. So I'm looking at both of you. But I think it will change, and hopefully for the better and for more convenience for some people. So it's more convenient for me maybe to do that, to try and get to a physical doctor appointment. I can't speak for all, the patient population, but I think there's a lot of people who will embrace it, and there'll be a mix. There'll be a hybrid model.
So much for us to learn. I have been involved with the rapid improvement programs at Pinderfields with the chemotherapy from when it was prescribed to the whole process of being made and then presented to the patient.
Yeah.
And I think we will probably end up looking at what has worked and how we've got to here and what we need to keep and what we need to get rid of after it's quietened down, because right now I think we're all just like, if it needs to be done, just do it.
Yes.
So I look forward to a time when we can all just step back and say, do you remember doing that? My God, did I really do it?
I actually think that if you look at the positives from it, what I was going to ask was, sometimes the patients don't want to go and have the face-to-face conversation because there might be a fear element, but also an element of embarrassment. And we all know that social media can create that anonymity and almost make it a sort of an experience that has a different level. Do you think that possibly would encourage people where they might have been too fearful to go to the GP and have the discussion? It might give them another option and make that possibility sort of more acceptable for them.
I think definitely, and I think I can only speak personally. It's not on behalf of the organisation as such here, but I know from family members. I've got younger people in my family, from university, etc. And if they want to ask something, they can be hugely embarrassed, as can many of us. And so it's often, I'll go to Google first. I'll find something out that way.
The worst.
And we're just like,
Don't do it. Don't do it.
Don't do that. go to a trusted site, go somewhere. And I think that needs to happen more. There needs to be, like the NHS sites that we've got, you know, the telephone numbers that you can ring. So I always get them confused, whether it's 111 or 101. I always get those two confused. But so that people can ring and, as you say, ask to a certain degree anonymous questions to help you shape your decision and think, I need to take action here, especially in those early times. So maybe we will see that more. And I think because of the way that we're going to have to operate in the future, maybe for quite some time to come, it could be something. But as I say, I'm not privy to all those conversations that are happening around operational management, but that's from my perspective. I think we'll see a change.
Would you be happy, Vikki, if I shared your contact details and your experience recently with the West Yorkshire and Harrogate Cancer Alliance?
Yes, of
Because it
course.
would be a great way of showing that, if in doubt, check it out,
Yes.
and how quickly you've been seen. It's beating the deadlines of NHS England 2-week referral. I mean, that
I
is
was just amazed. The GP
you.
was amazed. The GP it was early doors. It was right at the beginning, you know, and of the close down, and she was surprised. So she said, "I'm putting an urgent through, but it likely." She said, "I do apologise. It could even be up to 4 weeks. We don't know yet at the moment. We don't know." 2 days. Really? Do you know? So it was obviously reassuring. Gives you that worry because you think, do they
Yeah,
know something that I don't know? But it was, and yes, I'd be very happy for that to go
thank you.
forward and to reassure people, please take action.
So, Vikki, obviously there's different ages of volunteers, and I'm
Yeah,
thinking virtually going forward, we might be able to have volunteers doing this kind of thing with people at home if they've had proper DBS check-in and
yeah.
training. If someone wants to get in touch with you at Voluntary Services, wants to complete or download the volunteer form, how do they do that?
Okay. So at the moment, we aren't actively taking on volunteers whilst we are in this phase of, so what's next? How are we going to change our services to respond to this next step? So there's lots of work nationally with NHS England, but we are very happy that people contact us and they can give us an expression of interest, and we're keeping a record of expressions of interest so we can go back to people when we know what our ask is going to be of
I'm
people
just
and
thinking,
how we're going to set that up.
um,
So shall I share you my email address, the
I
email
would
address?
would absolutely love that, because I just think now is a prime time to get people out there, whether they're stitching something or they want to make a difference or they
Yeah,
want to put something on the CV. It's a quiet time, so let's get the message out there.
yeah, definitely. So it's actually Mid Yorks, MIDYORKS dot volunteer at nhs.net. That's our team email address, so anybody can put on there and they can express, I'm interested in volunteering. It may be after lockdown, it may be whenever. Can you tell me more about it? So people will get an acknowledgement and a reply, say thank you very much, and we will get back to you as and when. And we'll keep your email address, contact details for as and when, because it's a responsibility for us to look at things differently, like we've just been speaking about for patients, but for volunteers, in what way? Um, if people are really interested in doing something right now, there is in Wakefield area, there is the Wakefield volunteering, and that is, some people are doing your virtual volunteering with that, your telephone volunteering, and there's also the NHS responders. I'm afraid I should have been prepared and had that email address here, but I can always share that with you afterwards so you can and
Yeah.
share that with people.
I think you're signed up as one of those responders, aren't you, Emma?
Yeah, I am. Yeah, yeah.
Yeah.
It's a it's a app, isn't it?
It's Good Sam app, yes. And I think there's been varying experience of it because 750,000 people came forward to volunteer, but organisations such as ourselves weren't set up when people were ready to volunteer. So I think that's part of it. They've been ready and willing volunteers, but the system hadn't caught up, if you like. So now we have our community teams in Wakefield that are fully aware of it and can signpost patients through to it. we weren't slow in that. It's just that it was part of their rollout from the Royal Voluntary Services. And then now people can self-refer themselves as well. You don't have to be referred through an organisation. So if you are social isolating, you're shielding, or you have a relative that is, you need some help to get shopping, prescriptions, etc., you yourself can go directly to the Good Sam app and register and ask for some support, and they'll take you through to volunteers like Emma eventually. Oh, Emma, I've lost your sound.
I think people have been disappointed by the level of jobs they've been given to do through the app. But I also think that the area that you live in, you're given a very small kind of postcode area when you register
Right.
yourself. So you may not have a lot to do. I mean, I've seen the stats and the figures for people in Wakefield area. Doesn't necessarily, if there's 100 people volunteer in Ossett and Horbury, I might not get a lot to do.
Mm-hmm.
So it's very dependent. But I think originally when they rolled it out, it was almost like an emergency situation, and a little bit
Yeah.
like the sewing and the creating of equipment. People wanted to be useful.
Yes.
And there's almost that element, isn't there, that you've done something, you want to be useful, you want to kind of give something back, and now you're not offered the opportunity. So there's
Yes.
almost like an element of disappointment with it.
I
I
think
mean,
so.
I've obviously know Sara, some of the ladies, so I've done bits and pieces anyway because I know them. But I do think that it was possibly rolled out in a not quite the right way. Do you know what I
Yeah.
mean?
I
Yeah.
think there's some
I-
learning points. If we look at the media as a whole, I think unless it's bad news, there's always a slant on it to make news. And I look at things like, as someone shielding, being able to get shopping, getting a slot with where you put on the vulnerable list with the supermarket has taken 6 weeks.
Yeah.
Mm.
Now my first food order gets delivered on Wednesday, and I'm
Oh, good.
overjoyed. I'm overjoyed because I'm eating all kinds of rubbish that my delightful friend is putting on my doorstep, and I'm thinking, man, exercise and diet has totally skipped the media in terms of look after yourself in these trying times.
Yeah.
And I'm just jumping for joy and can't wait for that food parcel. But we were getting text from the government saying you're on that list and you will be allocated a supermarket, and we're thinking, yeah, but when?
Yeah.
And
Mm.
everything has to come out in various tranches of information. But I don't think anybody could have prepared for this. But I think it could have been managed a lot better.
Yeah. I think
Um,
there'll definitely be some learning as there is with anything. And in one respect, I view it personally that it's a good thing that people haven't been as active in the communities. We haven't necessarily reached the peaks and the spikes that were right at the beginning were anticipated that this could reach, and therefore people would have probably been more active than they are now.
Mm-hmm.
Whereas it's been more of a managed peak. What comes forward, we don't know. So therefore, please stay registered if you're on with the NHS responders, or you're with Wakefield, or you're with Kirklees with their voluntary action centres, because you'll still, or whether that be your COVID mutual aids that were established right at the beginning as well. So everybody's doing it all for the good of their communities. And I'd say, please stay active, because we don't know what's yet to come with the next stage in communities. And that I don't mean as a worrying stage, but just that this could be
mental health.
extended, and therefore, like you say, people can't get access. My parents still haven't got access to a supermarket shop on the shielding list yet. My parents-in-law have. So it's that people will still need support with, won't they?
Mm.
Yeah. So I guess really, Vikki, we've covered quite a lot of topics there. If
Yeah.
you were to give a message to the community from the hospital and the staff in terms of what people have done in their spare time as therapy or to give back to the hospital, what would you like to say on behalf of the staff at Pinderfields and Mid Yorkshire hospitals?
2 words, and often though, you know, it is thank you. It's just 2 simple words, but it's the passion behind that, the emotion behind that, the impact that you've made. You've kept people safe when you're providing their uniform bags, when you're providing their scrubs. Our staff have been able to operate safely. So we do have supplies in the organisation that have come corporately, nationally, but we have more staff that need to use those items. We need people to change more regularly. So that's why there was a need for additions. It's not that there isn't anything coming from the organisation or nationally. We just need more of it. So please be assured you're helping keeping our staff safe to provide you, the patient, the community with the care that they need out in the community and in the hospital. And just a great big hug and a great big thank you to you all for keeping going and doing what you've done.
I think it only goes, it's 360 degrees, isn't it? If you are giving as a member of staff or a patient or out in the community, we're all doing this together. I think Emma and I are extremely humbled that you've taken the time out during your time away from work on
Oh,
holiday.
bless you.
It's very
No, thank you for asking me.
great stuff. Thank you.
Thank you.
Thank you. Bye now.
Bye.